Now, we had expected to have Vence Bonham with us, but as Gwen mentioned, his family has a medical emergency. So they put together this really fantastic tape. It's a whole production. It's really good. Vence I've had the privilege of working with him. He is the acting director for the National Human Genome Research Institute, and he's also a member of the senior leadership team and a researcher in that. He was trained as a lawyer, but his career has really been spent more in healthcare policy and research. And his lab focuses very much on the social implications of what this new knowledge that we have means, and particularly in communities of color. And he really studies how genomics influences the use of race and ethnicity in biomedical research and clinical care. And he's just an incredibly just great, warm human being who really brings a tremendous amount of humanity to his work and to the science that he does.
Good afternoon. My name is Vence Bonham. I'm the acting deputy director at the National Human Genome Research Institute and an investigator in our social and behavioral research branch in the Health Disparities Unit. I am so pleased to be here today to participate in the National Patient Advocacy Foundation Policy Consortium, Identity and Healthcare Experience. I'm so dismayed that I can't be there in person to participate in this lively conversation at the consortium today. But I did want to share with you a few comments that I think are important for the conversation about thinking about identity and the healthcare experience, identity and science, and how we're moving forward as a country to improve the health of all. What I would like to do with my time is to give you some context of what I think are important issues of identity of a lab, of a research group, of a team who is striving to cultivate diversity. We must reflect on our last 2.5 years in the pandemic and the summer of a racial reckoning, genetics and scientific racism, and why we are striving to cultivate an ethos of diversity with an anti-racism approach. I will end my talk by providing you the opportunity to hear from my colleagues, members of my lab, as we are seeking to explore and move forward our work. Our world has changed since January of 2020. Each of us has been personally impacted by the COVID-19 pandemic, our families, our communities, our country. In the last 2 years, we have seen more than 1 million individuals lose their life to COVID-19 in the United States and millions globally. In 2021 and 2020, the US healthcare system was overwhelmed by the pandemic. The healthcare system in our country have all but been fundamentally changed by the COVID-19 pandemic. We have changed our healthcare system in ways that have been positive. One area that I would argue has been very positive is around telehealth, and ways that we've created barriers and obstacles and challenges in providing healthcare to individuals across our country. But it truly has been changed by the environment of our pandemic and our society today. At the beginning of the pandemic, we saw significant health disparities based on race and ethnicity, and identification of individuals who were getting cases of COVID-19 and the deaths seeing a very disparate background based on your place within our country. One thing that this pandemic has exposed for some is the structural racism and inequities that exist in our country and globally. But for others, it has just reminded us of the inequities that exist and that we face on a daily basis. It has challenged the scientific community to be careful, and particularly the genetics and genomics community, to be careful not to associate the disparities in COVID-19 cases and deaths based on genetics. Once the vaccine was available, beginning in December of 2020, the structural inequities in our system exposed disparities in access that correlated with social status, race, ethnicity, geographic location. And clearly this had a great impact on communities of color, where access to the vaccine early on was barriers that existed that were common barriers with regards to barriers and access to healthcare. The summer of 2020, we were also facing not only the pandemic and being locked down, we were facing, quote, the racial reckoning in our country. The murder of George Floyd, videotaped by Darnella Frazier for everyone to see, was a reflection point in our country. The systems of racism and health inequities were unveiled to some that were lived by many. We grappled with murders of Black men and women that has challenged us to make a change. As we were struggling with the pandemic and racial reckoning, the world and scientific enterprise didn't stop. Each of us in our own way continued our lives, our work, and moving forward during our close down in the pandemic. And issues of genetics and scientific racism continued to expose themselves within our society. The ideology of race, a concept that has been foundational to the field of genetics, separating the human species into racial groups and reinforcing ideals of hierarchical superiority based on biological differences, in quotes, among these groups, is an ideology that we continue to struggle with. White supremacists have used genetics to support their racist beliefs. And the scientific community has pushed back and continues to push back to strive for an anti-racist science. This is not something that just has been in our history. This is today. And you see in May of this year, the shooter in the Buffalo mass murder used genetics research to justify his murder of Black people. The American Society of Human Genetics and all of the genetics and genomics community pushed back and responded to the use of genetic research in such a racist way. And the American Society of Human Genetics in their statement said, the human genetics community is appalled at the news that the shooter in the hate-fueled mass killing in Buffalo rooted his racist beliefs in misusing and misrepresenting the science we strive to advance each day. As we in 2018 and again in 2020, the human genetics community rejects in the strongest possible terms any attempt to twist and warp genetics knowledge to advance bogus racist ideology or try to legitimize through science the fundamental hatred that forms white supremacy's evil core. The National Human Genome Research Institute published a strategic vision for the future of genomics in October of 2020. We included in this vision 10 bold predictions for the field of human genomics by 2030. One of those bold predictions was that research in human genomics will have moved beyond population descriptors based on historic social constructs, such as race. My research group, my lab, has been conducting research on the study and understanding the use of race in genetics and genomics. We published this paper in September of 2021, Evolving Use of Ancestry, Ethnicity, and Race in Genetics Research, a survey spanning 7 decades. You see, we looked at the American Journal of Human Genetics, one of the premier human genetics journals, and we looked at its history from its beginning in 1949 and how different terms were used to describe populations. We found that some terms have increased in their use over the last decade or two, including ancestry and ethnicity. And then we've seen a decrease in some terms, such as race. So the framing with regards to our research in our group around exploring the integration of genetics and genomics into clinical care and society includes the context of how populations are described, how race is used, and the historical context of scientific racism. But I want to explore now in my talk today, my lab and my lab's work seeking to cultivate an ethos of diversity. In the pandemic, my lab, my fellows and staff came together where we were not in person, and many not having ever set foot on the National Institutes of Health campus in Bethesda, Maryland, to build a research enterprise with our lab and to learn from each other and to cultivate an ethos of diversity. In this world of a pandemic, racial reckoning, continuing scientific racism, our team came together to conduct research on the integration of genetics and genomics into health and its impact on communities of color and to underrepresented groups across our country. And when my team came together, we sought to build a lab. This is a picture, a Zoom picture from the middle of the pandemic when we were all locked down, coming together to engage, to have conversations, to debate, to discuss, and to move forward our research. So I am honored and pleased to share with you this Zoom picture from our experience during the midst of the pandemic. And one of the things that we did early during the pandemic as a lab that came together was to read a book. And I am so honored to join Ms. Wilkerson on this stage today, because you see, the first book that my research group read after the beginning of the pandemic was Cass, The Origins of Our Discontent. The quote here that I'm sharing with you from the book's epilogue articulates our goal of cultivating diversity as an ethos as a research team. Radical empathy means putting in the work to educate oneself and to listen with a humble heart, to understand another's experience from their perspective, not as we imagine would feel. Radical empathy is not about you and what you think you would do in a situation you have never been in and perhaps never will. It is a kindred connection from a deep place of knowing that opens your spirit to the pain of another as they perceive it. So my research group came together from diverse backgrounds, geographically, culturally, ancestral backgrounds, to come together, to engage and to build a spirit, build a ethos, and to work together. And I just want to thank Ms. Wilkerson for her book and exploring and challenging us all as we were seeking to use her book as we were developing and struggling with how do we understand where we are as a country and how do we move forward. Our lab, as we built it over the pandemic, decided that we were going to come together, all of the members of the lab, and write an article for ourselves, really a reflection and introspection for ourselves, but also to share with the community about cultivating diversity as an ethos. And I refer you to this commentary that was published in the Human Genetics and Genomics Advances and is available online. And so I'm going to spend a few minutes going through the commentary and some of the things that we wanted to share with the scientific community and with the public. So what does diversity as an ethos mean? Well, ethos is a fundamental character, custom, ethics, spirit of an institution that allows for its persons, ideals, and practices to coexist in synergy. So creating an environment that is open for people to bring their voices, their views, their perspectives together. Conventionally, diversity is framed in terms of representation, but we argue that it does not stop there. The key point of our article is that diversity is not an outcome, but a process of living and not an outcome of numbers. We identify steps to shift toward diversity as an ethos. First, valuing diversity beyond the numbers. Second, diversity is not a favor to the underrepresented groups in science. And third, the diversity requires challenging institutional norms. Building a diverse team does not stop at increasing representation. Rather, it starts there and should be subsequently moved toward efforts that consistently challenge the norms and conventions that perpetuate underrepresentation and exclusion. So as we think about this issue of moving beyond thinking about diversity as numbers and quotas, but thinking about how do we create a space, an environment for individuals with different life experiences to come together in a focused way and a coordinated way to move forward with their work, and in our lab to move forward our research. Increasing the scientific workforce diversity does not merely benefit individuals from underrepresented communities. Greater workforce diversity advances scientific innovation and the scientific enterprise at large. I think this is an important statement to take a minute and think about. That when we think about enhancing and creating diversity, it's not for those that have been left out. It's for everyone. And so it's extremely important that we don't frame and think about diversity from the perspective that we need to include someone because they have been left out. But we need to think about it that we need all to be part of this process to help each other, to elevate each other, and to benefit each other. So don't perceive that diversity is only for those that have been underrepresented. To truly enhance diversity of the workforce, we must reckon with the norms and practices that deepen the gaps in representation within our scientific enterprise. We must think about the barriers and obstacles that exist that cause the disparities that we see with regards to who is in the scientific enterprise. One of the areas that I think is extremely important for the scientific enterprise is what happens early in our education systems across our country. Who is getting educated in science and is having the opportunity to grow and to develop and to become excited about science, and who is being left out? And how can we make sure that early education is providing the foundation for individuals to have the careers within biomedical research and science? We state in the commentary that the cultivation and adoption of diversity as an ethos requires shifting our focus to be intentional about the institution's character, culture, and climate. And that one way for this ethos to be sustained is by facilitating an intentional anti-racism approach within the field. I encourage each of you to think about your work, your team, your organization, your community, to build an ethos of diversity, to promote innovative and important science, improve health for the all and within our communities. So racism, what is it? It is the interwoven hierarchical system used to organize structures and opportunities based on the values assigned, including nationality, ethnicity, phenotypic, or other markers of social difference, and how these values are socially interpreted. As we think about our systems of difference, which are issues of importance of how do we address them and the racism that exists. Well, what does an anti-racism approach mean? Well, we as a lab and within our article, we argue that an anti-racism approach is intentional, it is critically introspective, and it's willing to sit with discomfort. And I want to just take a second and talk about this issue of sitting with discomfort, a recognition that we don't all know, that we don't understand everything, and that people may perceive that they are being racist, but we need to provide a space for everyone to talk, to communicate, and to create an environment to move forward. So a recognition of sitting with discomfort is a part of the process of creating an anti-racism approach. So as we come to the close of my talk, I want to just share with you a couple things. As we think about moving forward, we must recognize our history, the experiences of individuals that we've had across our country within this pandemic and within this period of time. And to understand that only with our ability to work together can we truly move forward to advance the work, to create innovation within science, and to improve the health of all populations. So moving forward, this means examining the history of the fields that you're working in or the work that you're doing and where we are today. And how do we move forward to truly advance the health of our population and the science that I'm so excited about and my research team is so excited about. So with that, I want to highlight here in our article, we provide a set of questions that are starting questions for you to have a conversation, to have conversations about your own teams, your own groups, and your own organization. And we look at these both from a structural interrogation and a personal reflection. I encourage you to look at our article, to think about these questions, to come up with your own questions as we move forward to create an environment and cultivate diversity as an ethos. So in closing, we present a framework for cultivating diversity as an ethos, utilizing an anti-racism approach. We examine that this is not easy or something that will occur quickly. It requires intentionality, reckoning, interrogation, introspection, and reflection. And with that, I want to say thank you. I am so pleased to be able to participate in this important symposium. And with that, I would like to introduce you to my lab, members of my research team who published the article that hopefully you will have an opportunity to read. And they will talk about from their own perspective, what does cultivating diversity as an ethos with an anti-racism approach mean for healthcare and the scientific enterprise? Thank you and welcome to my lab.
Hi, I'm Ashley Bucetta, and the question is, what does diversity as an ethos mean to you?
Hello, everyone. I'm Dr. Shamika Poetry Thomas. And to answer that question, so many different words come to mind, but to kind of be concise here, diversity as an ethos is less about numbers and more about fostering climates for social and cultural immersion, for multiple narratives to coexist simultaneously. It is the embodiment of anti-racism through intentionality and introspection within institutional dynamics and research processes. It means that we are not quick to rush to solutions without assessing that we actually have a problem. In fact, several problems overlapping. And there are some problems that some groups are more conscious to and others are less conscious to, but these problems, they coexist and they're historical. They're not just contemporary problems, but they are informed through lived experiences, through cultural dynamics, as well as historical dynamics that are embedded in the fabric of the nation, of the country. It is the story of who we are and how we've gotten here. When it comes to ethos, however, it's less about trying to acknowledge that we have these quotas to meet in terms of diversity, or more about how are we treating the workers and scientists and scholars who work to uplift and remove and alleviate the social problems that exist in social research, but also the scientific enterprise. And as this relates to patients, this is very much so an indirect as well as a direct impact on patients' lived experiences and how they assess the means and assess the tools to make their lived experiences better for their human conditions overall. So this is also about accessibility as well as the lived condition throughout the institution, but also toward patient treatment overall. So my way to close out to answer that question is that if we allow diversity as an ethos to be expansive in this way, it takes a personal and a collegiate stance toward contributing to the betterment of patients, the scientific enterprise, and overall humanity.
Hello, everyone. My name is Fabian Wasson-Seged. And to me, diversity as an ethos is about an honest effort to reflect on and evaluate what factors we as an institution place value on and why. So, within the scientific enterprise, this may look like an evaluation of who we allow into this enterprise and who is missing. And it's also about acknowledging the benefits of diversity aren't just a favor to underrepresented individuals, and a recognition that the only way we can progress as an institution and as a research enterprise is through the strength that comes from a broad number of perspectives and wealths of knowledge. In patient care, this may look like an intentional effort to fill gaps in populations that are underrepresented in medicine. But, beyond that, making sure that these clinicians are empowered to pull from their unique experiences to connect with and care for their patients. So to close out, overall, diversity as an ethos requires a deep reflection, intention, and really a willingness to challenge the status quo.
My name is Kiana Amini. And for me, diversity as an ethos means reflecting on the culture of the institutions we work in and represent. It's more than just what the institutions look like in terms of makeup, but also what kind of environment there is for people of different backgrounds to work within and just simply exist within. Within the scientific enterprise, it's a question of whether scientists from different backgrounds are able to authentically work together, whether they are encouraged to draw from their lived experiences to inform and enhance the science they produce, and whether they are able to bring their full selves to the workplace. And extending this to the fields of patient care, it's a question of whether providers, especially those from underrepresented backgrounds in medicine and healthcare, are able to draw from their lived experiences to inform patient care and advocacy for misunderstood or overlooked patient populations. Therefore, by making the field of medicine and healthcare not just more diverse in makeup, but also diverse in ethos and culture, patient care and health equity can correspondingly be improved.
Hi, everyone. My name is Rocky Willard. To me, diversity as an ethos means being curious about the knowledge and the systems that we've inherited in order to better understand the limits of our own perspectives. I think all great science is built from that same kind of critical thinking and reflection and curiosity. So extending that beyond just the science that we do to like the way we think about everything and in our institutions and our environments strengthens not only ourselves and our perspective, but that of everyone around us. And I think the other part of diversity as an ethos is part of an institutional culture that expects you to take action to leave the spaces that you enter better and more inclusive than they were when you entered them. I think it's kind of a belief that we can build something better than the systems and the knowledge and things that we have today. So it's like an optimistic vision for the future. So extending that to patient care, I think diversity as an ethos benefits both patients and physicians because it grounds that relationship in humility and acknowledging that both sides have knowledge to bring, and that diverse sources of knowledge and diverse experiences, strengthen our ability to solve problems and to provide better care and to just connect as human beings.